Most people can agree that improvement, especially improvement that results in better patient care, is a desirable but often daunting goal. For example, let's say your patients are waiting an average of 60 minutes in the clinic. They are frustrated and the clinic staff is overwhelmed, often taking the brunt of patients' frustration. In wanting to make a better experience for all, you and your team have been tasked with trying to reduce wait times in your clinic. How might you make a plan to systematically trial and adopt effective strategies to tackle this problem? There are a number of models and tools you may have heard of, like Lean, Six Sigma, and the Model for Improvement, to name a few. The focus of this video is to showcase how you could use the Model for Improvement and its use of plan, do, study, act cycles, sometimes referred to as plan, do, check, act cycles, to help establish a coordinated and systematic approach to an improvement initiative. The Model for Improvement, developed by associates in process improvement, is commonly used in healthcare settings and is recommended by the Institute for Healthcare Improvement, IHI. It is a tool meant to make improvement changes less intimidating and more actionable by breaking the process down into manageable steps and small tests of change through the PDSA cycle. The cycles of PDSAs can be iterated or adjusted and repeated rapidly over and over and over again to help progress toward larger goals. It moves the needle of change in slow, steady steps. With the Model for Improvement, you begin a project by asking 3 questions before beginning the cycle. What are we trying to accomplish? How will we know that a change is an improvement? And what changes can we make that will result in improvement? Going back to our target project, let's walk through how we might apply the Model for Improvement. For the first question, what are we trying to accomplish? This is where you want to quantify your SMART aim that is specific, measurable, achievable, relevant, and time-bound. Your team decided to answer this question by setting a goal to reduce patient wait times from an average of 60 minutes to 30 minutes over the next 3 months, with an overall aim of improving the patient experience with their clinic visits. As you set a goal, remember to also consider the patient perspective or voice of the customer. Is your goal meaningful to them? Would it improve their overall patient experience? It is possible that your goal may not align with the stakeholders' needs, preferences, or priorities. If this is the case, be sure to reconsider what it is that you're actually trying to accomplish before you move forward. Let's now turn to the second question. How will we know that a change is improvement? Answering this question can help your team determine what measures or evaluations would be helpful to decide if the changes you are trialing are actually leading to an improvement. Setting quantitative measures such as outcome, process, and balancing measures can be very helpful for tracking and documenting change. We'll cover these common measures in later videos. For now, just know that you can evaluate change through quantitative and qualitative data. Going back to our example, we might decide to use a combination of measures to help us work toward our goal of reducing wait time. We can measure weekly average wait times across all patients visiting the clinic, patient satisfaction as it relates to wait times, and number of patient complaints related to wait times. Additionally, maybe we will periodically talk to our clinic staff to get some qualitative feedback on how they think the change is going. We must be cautious here, though, to make sure we are not overburdening our clinic staff as we work toward our goal. Once your team has decided on some measures for determining if the changes you are making are improving aspects of care, the third Model for Improvement question becomes the focus. What changes can we make that will result in improvement? To answer this question, you must first understand the current state and determine potential opportunities for improvement. This can be accomplished through Gemba walks, a way of observing the process, consulting with stakeholders like clinic staff and the patients, and using other quality improvement tools like process maps that can visually depict the steps in the process. You might also seek out evidence or talk to other clinics to identify potential changes you could try in your clinic. As a team, you should brainstorm lots of ideas so that you have a variety of options to try. At this stage, it can also be helpful to document your ideas in a tool called a key driver diagram, which we will cover more in depth in a supplemental video. For example, perhaps your team has identified the following change strategies or interventions you would like to try. Implementing a triage system to prioritize patients based on the severity of their condition. Hiring additional staff or reallocate existing staff during peak hours. Implement a system to notify staff of wait times and delays, enabling them to inform and manage patient expectations. With these ideas, your team is ready to start testing possible solutions with PDSA cycles. In the next video, we will explore each step of the cycle as it applies to our example of reducing wait times.